take one of these blankets. There's some space over here. You can sit down here or there, wherever it's comfortable. Yeah, that's the day. I think we probably should start. If somebody wants to come in, we just catch them off with what's going on. So welcome everybody. Thank you for coming in today. I think we have a really good turnout. So my name is Masha, with Dr. Masha Ishkanova-Goodson, and it goes Dr. Masha for easier since the last name is long and hyphenated. So yes, I am a naturopathic doctor, and I have a practice here in Sacred Roots, coming in, and in Huntington Beach in Harbor Health Center for the convenience of patients for both towns. And like I said, I'm a naturopathic doctor in the state of California. And if you want, I can tell you a little bit about naturopathic medicine. Naturopathic medicine is a branch of natural medicine, and I'm sure you've heard about acupuncturists or Chinese medicine, Ayurvedic medicine. You've heard about different holistic healers. So naturopathic medicine is a branch of the alternative medicine. And naturopaths, they go to school, to medical school. Naturopathic medical school is usually 4 to 5 years. And the curriculum is similar to the curriculum in regular medical schools, only that the emphasis is more on botanical medicine or herbs, homeopathy, physical medicine. We study nutrition really in depth for 2 years. So we have a lot of tools actually at school. We just study a lot of tools, and naturopaths tend to specialize in different areas, so they choose modalities, we call it a type of treatment, and they may just do physical medicine in their practice, or homeopathy, or a lot of herbs. So that's about the naturopaths. If you have more questions, so we can talk about it in the end a little bit more. So I decided to do this talks, 4 pillars of healthy living, and today we're going to talk about sleep. Of course, there could be more than 4, right? 4 is just a number. It could be 5 or 6, 4. Every person, it's a different approach for healthy living. So, and one of the most important parts of our life, of our daily living, is sleep. Though we always think about, like we had that conversation, that nutrition, right, is so important, or movement, exercise are, they advertised a lot how we all need to move and exercise, and it's so true, and how we need to eat a healthy diet. And there's so many diets these days, it's kind of even confusing. What is the ideal diet? But we talk less about sleep, though we take sleep for granted when we have it, right? But when we lose it, it is the worst thing sometimes that could happen, right? Not being able to fall asleep, or not staying asleep, waking up often, it's painful. And it also causes mental fogginess. You don't think straight, you are tired easily, you're irritated easily, so it just comes in with lots of different things. You feel like you are just literally sick from not sleeping. So let's talk about sleep. So how important is sleep in our life? So, and I decided to talk a little bit about the science of sleep, and I'm sure you heard about it, how sleep happens, and it's kind of fascinating what happens when we fall asleep. So you probably heard about rapid eye movement, right? So the sleep oscillates between 2 phases, non-rapid eye movement and rapid eye movement. So when it's a non-rapid eye movement, it happens when we fall asleep, and we go through several stages, and it's on the next slide. Can everybody see the slide, or not so much? Can you see? No? If you want, you can move a little closer, but there is a little carpet right over there, so you can see. So let's see. Can everybody else see it? Mm-hmm. All right. So let's see, maybe I'll move to the side over here. So good. So yeah, you can see on the diagram by minutes that it's a first stage, second stage, fourth stage, and then we go into REM sleep. So basically it shows how long each stage lasts, and this is measured through the electroencephalogram. So when we fall asleep, first we go into non-REM sleep, so no rapid eye movements, and it's a deeper sleep, it's a slow waves, and we tend to sleep profoundly and don't dream. So we'll talk a little bit more about it later. And when it's REM sleep, rapid eye movements, it usually happens closer to the morning, and it's similar to waking, and we tend to dream a lot during that time period. So here is a slide you can see over here. So this is for babies, this is for young adults, and this is for elderly people. Basically, the interpretation of this is that once we get older, we tend to stay less in a deep sleep. Babies sleep in a deep sleep all the time in the non-REM sleep, but once we get older and older, then we kind of lose this quality of sleep. So therefore, maybe there is less repair happens. Maybe that's why elderly population tends to go to bed a little bit earlier and they wake up earlier. It's just sleep becomes a little bit more an issue. So for some people, you know, for other people, not so much. So this is a fun slide to compare us as human beings to other animals. So you can see that some animals actually have a lot of REM sleep, or you know, like dreaming, or maybe not such a good sleep, like a possum, right? They have 6.6 hours that they spend in REM sleep, rapid eye movement sleep, and they sleep total for 18 hours, which probably they compensate because the sleep maybe for 6 hours is not such a deep sleep. In comparison with dolphin sleeps for 10 hours in only 0.2 hours they spend in REM sleep. So that's kind of amazing. They really sleep deeply. Though it's hard to imagine how can you sleep so deeply in the ocean, right? It's just, it's hard. It's kind of cold, right? And you have to, I don't know that much. Do they move, or do they? So they probably move a little bit since they spend in non-REM sleep, but maybe they don't dream as much as others. So who knows? Maybe only humans dream. So what happens during sleep? Why is it so important that we sleep? So one important thing happens during sleep is we consolidate the memory. Whatever happened during the day, at night we go to sleep and it all goes to different parts of the brain where it should be. And even here it's broken down. The early sleep dominated by slow waves or non-REM sleep, we tend to consolidate or put into pieces the declarative memory, which is facts and events, and procedural memory, how to do certain things like play the piano or work the machinery. So we do it in the early sleep. And then at late sleep, we do a final consolidation of all the memory that happened. So like they say, right, if you cram for the test and the test is at 1 o'clock in the afternoon and you study in the morning and you didn't have that sleep, right, there is a less chance that you will be able to recall the information, because it's not that what we remember, it's what we recall during the testing. So there is no wonder why people say you have to sleep on it and then you'll remember it better, because actually the remembrance happens at night. So yes, study beforehand, sleep, and then go take the test. But it's true for other things, not only for testing, but if you're a student, maybe it's something that you have to consider to do well. So in this deep sleep, it's a decrease in muscle tone, heart rate, breathing, blood pressure, metabolic rate, but they will still toss and turn, which is interesting. Our muscles are relaxed, but we still can move around. And some people sleepwalk, but they don't dream. So it's inactive mind in inactive body. So actually they dream. There is no dreaming happening. And there's no really active thinking happening, whatever happens at night in terms of the dreaming or the memory consolidates, but we're not really aware as it is later in REM sleep. But it's interesting that the body can move, right? Kind of amazing that inactive mind in an active body. In the REM sleep, not deep sleep or sleep that happens closer to the morning, the large muscles are paralyzed. You can't move. And you have an increased blood pressure and heart rate metabolism, and that's when the dream and visual hallucinations happen. And it's an active mind in an inactive body. So maybe it happens so we wouldn't enact our dreams, right? So if we're escaping from somebody, or if we're chopping something, or if we're doing something, so otherwise there would be all this movement. Some people still move, right? Everybody's different. But I guess the nature did it like this, so though there's a lot going on, emotions of the day, memory, final consolidation, but yet you kind of like paralyzed like this. So this is kind of fascinating. Let's see, more on memory. So the sleep allows memories to be incorporated without disruption with other older memories. So the new memories they can also be reactivation of older events. That's why sometimes dreams we see people from 20 years ago, right, or something that happened so long ago, because actually these memories are coming back to us. So, and the REM sleep is also thought to consolidate emotion. So emotions that we went through the day, maybe that's why dreams are so connected with our emotions. So let's see, what else happens during sleep? We talked about memory and emotion. Regeneration of cells. So cells renew themselves. We need to renew the cells to keep on living. So, and appropriate sleep is considered to be anti-aging. And if we want to have a long life, right, we better get good sleep, right? With proper nutrition, exercise, sleep is paramount. So, and then there are some studies that show that people who tend to go to bed after midnight consistently, right? We don't mean once in a while, but consistently, they actually don't let their brain to do all this work that we talked about, the beginning of the consolidation of memory. So they might be losing a little bit in this. And people who sleep less than 6 hours at night have a shorter life expectancy than people who sleep longer than 6 hours. These days, it's considered the optimal, the average time to sleep 7 to 8 hours. Of course, there are people who would claim they need to get 10 hours. That's the only time they can function. And it's all right, it's individual, but for the majority of population, the recommendation is, if we have to generalize, is 8 hours, 7 hours. Less than 6, not so optimal. And of course, it depends if somebody had a newborn, or there's a sick relative, or we have to temporarily to sleep less, it's okay. As long as we don't do it for 20, 30 years, sleeping less. Then we have hormonal regulation. The cortisol, the hormone, the stress hormone goes down. Adrenaline goes down, so we're not all hyped up. But the growth hormone really goes up. And the muscles grow, tissues grow, the amino acids starts going to all the different spots. During the day we ate all these proteins, they're broken down into amino acids, and now it's the time to actually go to the muscles and tissues and feed them so they'll grow. Like they say, we grow at night, right? They tell to children that we grow at night. Another melatonin, another hormone that is produced, and we'll talk more about it, is melatonin. Is the hormone that is produced in the brain by the pineal gland, and this is the hormone that induces sleep. So this hormone is lacking, it's decreased, maybe there is an issue with falling asleep. So, and we'll talk about the body temperature, how it's important too, in order to produce melatonin. So in such hormones, sex hormones is testosterone, and fertility hormones, FSH and LH, are also secreted at night. This is kind of interesting. And then immune system is activated at night too. That not only at night, they say, well, you need to rest more when you're sick. It's not only that it helps us, but also we produce more immune cells, lymphocytes, cytokines, different other proteins to facilitate the healing. So, for example, they did studies of their healthy young adults who were going through who were sick, maybe like with a cold, and they were sleep deprived, and they had reduced amounts of white blood cells. So white blood cells fight with infections. Or for example, a cancer killer cell, a TNF, or in this case, it's tumor necrosis factor. The research shows that people who stayed up till 3 a.m. in the morning, right now, sometimes we know some people could stay till 3 o'clock in the morning. They actually had 1/3 of that particular cell and the next day, and the effectiveness of those that are remaining were greatly reduced too. So we need those immune cells to fight infections, to fight cancer cells. So in they're produced at night, so getting good quality of sleep or actually going to bed at the right time is important, right? Not going to bed at 12 or after 12 or after 3. We should go to bed around 9 or 10 and get this beauty sleep that we all really want. And as they say in Ayurvedic medicine, for every hour that you sleep before 12, you get 2 additional ones, right? So if you go to bed at 10 and you sleep till 12, and of course you continue sleeping more, but you get the benefit of 4 more hours instead of 2 more hours. So it's important the time when we go to bed as well as how many hours we sleep. So, and a little bit about how we can optimize the sleep or sleep hygiene. We're going to talk about sleep hygiene. So there is a hygiene that we might maintain, right? We take a shower, we maintain ourselves clean, brush the teeth. The same goes for sleep. A few little rules that make the sleep better. So it's best to fall asleep in a colder room or cooler room, which is around 60.8 to 65 degrees Fahrenheit, or if you would rather understand in Celsius, it's 16 to 18 degrees Celsius. So what happens, the cooler temperatures induce melatonin, and we talked about that it is a hormone that is responsible for sleep. So if you're really hot and the room is hot, the melatonin is not produced. You might be, besides of you being uncomfortable, is also the hormone is not there for the induction of sleep. So it's good to maintain your room colder. So degrees of liquids in the evening. For some people, it's more of the problem than for others. If we drink a lot of water or different types of teas, even herbal teas, before going to bed, then we tend to wake up a lot, right, to relieve ourselves. So the consensus is to try to finish liquids by 8 p.m. or at least diminish them, right, at least diminish them. So a lot of herbs are diuretic, or they stimulate the loss of water. So if you drink a lot of herbal teas, which are wonderful, and you want to drink them in the evening because you don't want to drink caffeinated drinks, but then they also make you go to the bathroom a lot at night. And what happens, you go to the bathroom, you turn on the light, it stimulates waking, you go back to bed. Some people have a trouble falling asleep. Some people are fine, right? But as a general rule, it's better to decrease the fluid intake so then you can sleep throughout the night without waking to use the bathroom. And of course, it goes without saying that it's best not to drink caffeinated drinks like coffee before going to bed, black tea, green tea, because, well, they tend to keep us alert, and also they tend to make us go to the bathroom a lot too. So we want to prevent that. And these are just some recommendations for different types of herbal teas, and this is not a limited list. You can use a lot of other herbal teas instead of caffeinated, like after dinner or before dinner. And so there's some over here. So let's see. Oh yeah, I have a question.
I've heard that even decaf tea is you see the caffeine effects. What's your thing?
I don't really know exactly. I think maybe it just depends how they extract, how they try to get the caffeine out. But since it's still the tea, right? It may be still, maybe some left in there. So I'm just thinking the way they decaffeinate it, maybe there's still a little bit left. So that would be my answer. Let's see, then we have to make sure that the room is completely dark or pitch dark as much as you can. No TV, no light. You can have a little night light, but maybe not as bright. Maybe it's in another room, in the hallway, in the bathroom, but in the room itself, it has to be really dark. Dark curtains, blinds, so when you look around the room, you can't actually see things well. Well, it differs, of course. There is some population that needs to have a light because it's harder for them to get up and they need to see where they're going. But if there are no health complications, no precautions, then we should all be sleeping in really dark rooms. Because again, darkness stimulates the melatonin, and what wakes us up is the light. Whenever the light is on, melatonin rapidly decreases. So to wake somebody up in the morning, what you can do is just turn on the light, and they will wake up a lot faster because they will just decrease their melatonin. So let's see. It's best when we sleep to decrease our exposure to cell phones, Wi-Fi, and other wireless devices, because this kind of noise that is going on can be disruptful for us. For some people more than for others, but as a general rule, it's best not to have your cell phone right next to you. You can put it in flight mode that cuts the signal off if you use it as an alarm clock, but it shouldn't be radiated next to you like a little cell phone, a cell tower, catching the signal. It could be disruptful, especially if you do it every day. And also Wi-Fi routers, you can turn them off at night. You can use them during the day, but at night it's better to turn them off. Some people sleep really close to routers, like they have computer and their routers right in their bedroom, so they're just surrounded by it. And of course we can control because our neighbors are using it. But you can talk to the neighbors, offer them, if we all turn it off, good quality sleep. So it's up to you. And there is something I found that L-carnitine, one of the amino acids, actually helps to combat the radiation. So let's see. Then food intake before sleep. Yes, it's better to eat 2 to 4 hours before going to bed, because if we eat right before bed, except for infants, right, some other types of people, but diabetics, pregnancy, then we still have got the digestion happening, the energy is there, and we're trying to relax, calm down, and it's just hard because the body thinks it's awake time. We need to be digesting, doing, moving, but 2 to 4 hours before bed. There are some snacks if you're hungry. Well, been there. You're hungry before going to bed. You can eat walnuts. They increase melatonin. Tart cherry juice, but in small amounts. Increase melatonin. Almond butter has a high amount of magnesium, and magnesium helps us relax. So you can have the snacks. And then, so these are the sleep hygiene rules, and of course there could be more. Just listed the ones that came to my head. And we do naturopaths or other practitioners come in. Sleep, when it's a real problem, it has to be addressed, right? We cannot postpone, or we cannot think that it's not important, then a year passes by, if people come to you and they say, well, I only able to sleep for 2 hours at night and I feel so drained, I can't function. So yes, it's good to come earlier when this sleep problem just arises. So I'm a naturopath, so I'm going to talk about naturopaths, but it goes along also for other healthcare professionals and other alternative medicine practitioners who also address those issues. That as naturopaths, we always try to find out, and it's one of our principles, what is the root cause? And what is the reason? For some people, it's a stressful job. For other people, it's relationships. For somebody else, it's a recent grief. So it could be different partners. So we can't say that there is one miraculous supplement or one thing that they all should do, because it all depends on what the person is going through. And with herbs, it's interesting. Herbs can address exactly the cause, right? If somebody is really stressed, we have herbs that address the stress. If somebody just can't relax and they need to calm down, there are herbs that are for calming down and relaxing. They are typically in those herbal sleeper formulas that you can find in health food stores. So they are common, like passion flower or linden flowers or chamomile or lavender. So, but what is amazing, like some people take it and it doesn't help because it just doesn't address the root cause. Or melatonin, right? Like we would think they just need to take melatonin and this problem goes away. Turns out that doesn't solve an issue too. Sometimes you take as much melatonin as you want to. Actually, it's better not to take a high amount. It has a different action. And the people still cannot fall asleep. So as healthcare professionals, we do address what exactly is going on and try different things to help them with the issue that is going on, and hopefully once the issue gets resolved, then they're able to fall asleep. So, and let's see, and as a famous herbalist said once, that there is not a single herb on the planet that can replace good quality sleep, right? Like I said at the beginning, we think about nutrition, right? If you eat right, you will live a long time, you'll be healthy, you exercise, or you can say, I take this good quality herbs, supplements, and I'm good and healthy, but sleep, if you don't sleep, you don't regenerate those cells, you don't allow the growth hormone, you don't allow the memory consolidation, you're missing so much. So herbs can help you fall asleep, but herbs and other supplements cannot replace sleep. Sleep is too important, and we shouldn't take it for granted. And these are my references. And yes, if you have any questions, please feel free. And I also wanted to open it for discussion. What do you do for sleep? Maybe you have some secrets that you would like to share so we can all learn. Sure.
I have a question. You talked about actually going to bed at certain times, like before midnight.
Before midnight.
I am someone who's worked night shift in the past.
Right.
And so, I mean, are there ways that you can kind of cover yourself for those nights where you are up all night?
Right. Yes, I know. It's a big issue within a great time workers, right? With your workers, because it's just it's going against the nature, right? So the good way is to still try to maximally get the amount of time to at least 8 hours or 7 hours, even though you go to bed at 8 in the morning, right? Instead of going to bed at 8 at night. Or on the weekends, make sure that you go to bed at the right time. But I know it's really hard, because I worked in the hospital too for people who maintain the schedule at night to switch to daytime, and they're completely confused later. They can't even fall asleep. So you can try to do all these rules, only that at a different time. Of course, you're missing that aspect of going to bed at a certain time, but maybe if your body is used to it and it was already is becoming your second nature, it makes sense to the body to go through it, then just try to do the best you can. I don't think there is some kind of magic answer that
So why is it so important to go to bed at those times or around those times?
I think it just historically, physiologically, that's how we as humans were always doing. We were always, before the electricity, we were going to bed when it was the sun was setting down, and we were waking up when the sun was up, and maybe just throughout centuries and centuries and centuries, that's how it is in our DNA, that's our circadian rhythm. So we just kind of, we're just born, and it's just part of us, right? So part of maybe why we want to eat at certain times. So it's just part of nature. That's how we do it. When it's dark, we sleep. When it's light, and that's why the melatonin is produced only the darkness. It's not produced in the daytime, unless the person is sick, and then the cytokines or proteins stimulate the production maybe of a little bit more melatonin. You can sleep during your sickness, but overall, it has to be happening at night. Sorry, there's that no magic answer for people who have to work at night. Yeah, it's tough. So, any other questions?
Just as far as you mentioned that if you sleep whatever amount of hours before midnight, you double that time.
Right.
What's the concept behind that? So, because let's say that I just wake up a little later in the morning.
Maybe just the accent is put that it's such a deep sleep that happens during that time.
Like just because of
the
moon
deep,
or
right.
like Earth or.
I don't know
happens at that
exactly
time?
why they say it in Ayurvedic medicine. One of our teachers said it. But scientifically, to me, it makes sense because that's when the deep sleep happens, right? That is the best sleep at that time. That's why they say it's so valuable that it's almost like you gain 2 hours instead of 1. So that's how. But if you think there's another explanation that is possible, so I just think that it's just deep sleep.
That's why you're less grouchy when you sleep at 10.
I know. You're making him to sleep at 10.
No, she goes to bed really early at night.
Aw.
So she just like, if she doesn't sleep early, then she just has like a change of.
Right, that it's
Just
really
used
fast.
Yeah.
Right. It's true, some people are more affected by lack of sleep than others. Some people claim, oh, I sleep only 4 hours a night for a long time and I'm fine. But other people, if I don't get sleep, I am a wreck. I can't function. So it's so individual. But it's good that you know it about yourself and you do what is needed. So that's great. Anybody else? Any questions or comments? Maybe you have some comments about. Maybe Diane has some. Diane is a wellness coach, and she's been doing it for a while, so she probably has a lot of recommendations how to promote sleep.
Are you asking me to share something?
Sure, yeah, if you don't mind.
I can just say on a personal level that there are specific essential oils that I know. When you put them on me, I have one of those types of sleep that my head's on a pillow. A few seconds later, it seems, then the night's done. So that's my go-to.
The essential oils. Do you do like a bath and you put a little bit